Hi there. My name is Taylor Carls, and today I'm going to be giving my BSN Portfolio Presentation, and my main topic is going to be teenage pregnancy in Nebraska. I chose this issue because I wanted to learn more about how prevalent teenage pregnancy is in Nebraska. This population is one that is not necessarily thought about a lot. If you do not know someone that is a teenager and is pregnant, this issue is not necessarily on your radar, but it is a major problem in Nebraska. My personal connection is that I have always had an interest in women's health, and as I am getting ready to graduate, I have accepted a job in the neonatal intensive care unit at Women's Hospital. From my readings, I have recognized that a lot of teenage pregnancy cases have babies that end up in the NICU. So, as a future healthcare professional, I wanted to know what I can do to enact change for my community. And like I mentioned, it is a major problem in Nebraska. In 2014, Nebraska spent approximately $28,556,203 on teenage births that year. So, for my first effective communicator experience, I was actually in the least likely spot. I was grocery shopping with my mom at Hy-Vee, and we had just finished up and we went to sit down to get some Chinese because we were both starving. So an employee came out from the back and he was like visibly upset. He was just, you know, you could just tell something was wrong. So we were like, okay, whatever. And the next thing I know, he's in convulsions on the ground. And so I'm only in nursing 101 at the time. So that is the first nursing class. It's where we learn our assessments and, just our basic information. And so I rush over to him. I check to make sure he has a pulse. I make sure he's breathing and I turn him on his side. And before I know it, he comes to. But all while this is happening, I'm communicating with my mom to call 911, and I'm communicating with his fellow coworkers to, come over here and do you know this person? What's his name? Has he done this before? Just asking different questions to gain more information about the situation. The After he wakes up, he's just visibly upset still. He's crying. He can't really communicate with us. And it was just a very upsetting situation overall. So when the ambulance arrived, I explained what I had done and like what I had witnessed, and that was really it. So from this experience, I learned that not all communication takes place in calm and quiet settings, and for that reason, it is important to utilize all aspects of communication. As an effective communicator, there are things that I wish I could have done differently, such as using appropriate oral and nonverbal communication. I really wish I would have given more detailed report while talking with the ambulance and stuff. But I did what I could, and I just remained calm in the situation, and that's really important in becoming an effective communicator. So, as a future nurse who wishes to work in women's health, much of being a nurse is giving education to patients. So, in regard to teenage pregnancy, I can address this issue by giving more detailed education of my teenage patients along with utilizing more than just verbal communication. I can give them pamphlets and or brochures about the issue and just information that they can take home and really read for themselves. So, for my effective communicator experience number two, this was actually my senior year on the fourth floor of Methodist Hospital, which is rehab. Um, I got my same patients back the second day in a row. And so I had known all about them and what they had and what was going on and everything. But as we walked up to our nurse that day, you could tell something was just not right. She was very stressed out, and you could just tell it had been a long night. So, as we're getting, our report, I was listening, and it appears that our patient de-escalated very quickly. He had a brain bleed that we didn't know about. There was just a lot of different orders put in overnight, and she was just very stressed out, as any nurse would be. So I actually went and I was reviewing the orders that had just been put in, and I came across this one medication. I was like, this seems like it's just backwards to me. So I went online and I researched it a little bit and I was like, you know what, I'm right. So I went to my nurse and I was like, hey, can I talk to you? And I pulled her into a quiet hallway away from everyone else and I was like, this is what I have witnessed. This is my research. Like, this is what I've been thinking. What can we do about it? And she was like, you know what? You just witnessed your first med error. And I was like, oh my gosh, that's awesome. But we went to the charge nurse and we talked with the doctors, and she was really great about it, and we got it all figured out. But from this experience, I learned the importance of using critical thinking skills and speaking up when you suspect mistake or foul play. So in this instance, I took someone's written communication and communicated orally with my nurse to raise awareness of this mistake. By speaking up, I possibly saved a life, and it goes to show that in all instances, it is important to stand up for what you believe in. From this experience, I realized that in order to address teenage pregnancy in Nebraska, I will need to read written communication to learn more about the topic, and in return, I will need to communicate with others in a multitude of ways to make a difference in teenage pregnancy in my community. So like I discussed, I will, make pamphlets. I can communicate with them orally during, assessments and while they're at the hospital visiting me and all other types of things. So for my reflective individual experience, I was actually in nursing 240, which is mother, baby, and labor and delivery. At the beginning, we were assigned a weekly reflection journal, and at the beginning, I really didn't pay much attention to it, and I was just doing it to get the points. And, somewhere around halfway through, I was like, if I actually put the time and the effort into reflecting upon my week, I can learn a lot about myself and, just my week in general. And so I learned that by reflecting on my encounters that I could grow as a person, and by routinely engaging in habits of inquiry such as logic and critical thinking, I am bettering myself for my patients and I's future. So by taking the time to reflect and grow as an individual, I'm allowing myself to gain and process new information that can help to address teenage pregnancy in Nebraska. An example of this being that by performing my research on this topic, I'm able to reflect and think about how I can enable change in the future for my teenage clients. So this one assignment has led me to really reflect upon every week of mine. I even reflect daily. I think about what had gone on, what I could have done differently, and just, using that critical thinking skills, I really have learned a lot about myself and how I can better my patients. So, my reflective individual experience number 2 was actually when I was a care companion at Methodist Hospital. So, a care companion is someone who sits one-on-one with patients just to ensure their safety and the safety of others. So I actually was assigned 2 patients that day in the intensive care unit side by side, and both of them were in critical condition. And as the day went on, I noticed that one of my patients was just getting worse and worse. His vitals were getting worse, his confusion was getting worse, and so I just continually kept educating my nurse on what was going on, and I was just like, can I do anything? What can I do? So as the day went on, we didn't really do anything because she said with this disease process that was going on, it was normal. And, right around the end of the day, she actually spoke with the charge nurse, and the charge nurse came in to speak with the family and the other nurse, and they discussed possible intubation if it came to that. And while they were discussing that, the patient actually coded, which means that his heart stopped beating and he was just flatlining. So he was in critical condition, and the family actually decided to intubate, which means that they put a tube down their throat to help them breathe and to keep everything going and give them meds and stuff. So it was just a very chaotic day at work, and so I took the time at the end of the day and I was like, well, what could I have done differently for my patient? What can I do differently in the future? What should I have done? So in this situation, I engaged in natural and applied science practices to influence the way in which I thought and acted at that moment. So I took what I had known from my nursing classes and applied that to what was going on in that moment. So from this experience, I learned that by reflecting on your past, whether that be knowledge and experiences, it is information that impacts how you respond and act in the future. By reflecting on my past knowledge and experiences, I am able to use my knowledge and experiences to make a difference in teenage pregnancy. An example of this would be using my knowledge from class and clinical and nursing 240 to think about ways to which I can talk to teenagers to help prevent teenage pregnancy. I can think about the process of pregnancy, the whys of pregnancy. I can also reflect on my time as a teenager and think, what would I have done in this situation? What would I have liked? So for my first change agent experience, I was actually in 101 again. So that was the first nursing class. And I was in with a certified nursing assistant or a CNA, and we were giving a patient a bath. And, giving a patient a bath, everyone's like, wow, that's not hard. But, it was my first time ever giving a patient a bath. So it was something that I was excited to learn from. Well, my patient was just screaming out in pain. She was just, you could tell that she was visibly upset. And so I said to the CNA, and I was like, hey, why don't we come back later when she's a little more comfortable and, do it then? She's like, well, then you can come do it later. I'm busy. So I was like, okay, that's fine. So I went and talked to my teacher and I discussed what had happened. And she said, yeah, you did the right thing and you were a change agent. So go back later in a little bit and try and do it again. And the patient was so unbelievably grateful that I had stood up for her. And, she was an older adult lady, so a patient who was vulnerable and that typically gets walked over. And, so from this experience, I learned the importance of initiating change. I drew individuals together for a common purpose, and by doing this, we can show patients that we truly care and that we want what is best for them. So I drew my classmates together and my teacher, and I was like, hey, this is what's going on. Let's make a change. So when it comes to teenage pregnancy in Nebraska, it is important to take steps to initiate change, to make an impact. So by drawing individuals and organizations together, we can work together to enact change for this unique population. So as nurses, a large part of our job is doing education. So at well visit checks, we can mention the short and long-term effects of teenage pregnancy to all teenagers. This would be an example of nurses coming together to enact that kind of change. So from my change agent experience too, I was actually recently taking care of my grandmother. She was diagnosed with pancreatic cancer and it ended up spreading to her liver, so it was terminal. But my grandma had expressed her wishes to me, and it was really just along the lines of this is what she wants. And so I was able to give her that voice by standing up to doctors and nurses and to my family even and saying, this is what she wants. This is her wishes. This is what her will says. This is what she wants. So from this experience, I learned that it is important to give the patients voices. By giving them their voices, we are helping to initiate change in their cases. So creating a voice for myself and others is a goal that I will always strive for as a nurse. By listening to teenagers, pregnant or not, I can give them a voice by allowing them to express their concerns and worries. And by listening to them, we can address the issue in a different way that best suits this population. I will give them the voice that they deserve. So before starting this project, I thought it would be extremely hard tying in my experiences I had 4 years ago to teenage pregnancy. Throughout my 4 years at Nebraska Methodist College, I have only expanded my knowledge, but I have grown as a person. Everything that I have experienced so far throughout my journey has made me mature into the person I am today, and that person has the ability to help others. Teenage pregnancy is a significant problem in Nebraska, and after researching it, I feel as though I am able to make a difference in teenage pregnancy. Although it may not be today or tomorrow, I believe that by being an educated citizen, I can make a difference. As I embark on my journey as a new nurse, I will continue to grow into these 3 aspects to become an even better educated citizen. Thank you guys so much for watching.